Lysergic acid diethylamide, or LSD, was first synthesized by a Swiss chemist named Albert Hofmann in Basel, Switzerland on November 16, 1938. It was not until 5 years later, in 1943, that the psychedelic properties of LSD were discovered. After joining the pharmaceutical chemical department of Sandoz Laboratories, Hofmann synthesized LSD with the intention to obtain a respiratory and circulatory stimulant by using a medicinal plant called sequil and a fungus called ergot. In April of 1943, Hofmann performed a self-experiment to determine the true effects of LSD. Unaware that a regular threshold dose of LSD would be approximately 20 micrograms, Hofmann ingested 250 micrograms and began to immediately feel the psychedelic effects. Since motorized vehicles were prohibited due to wartime restrictions, Hofmann rode his bicycle home as his condition was rapidly deteriorating. He began feeling anxious that the LSD had poisoned him and that he was going insane. However, after a doctor reassured him that there were no detectable physical abnormalities, Hofmann's terror turned into enjoyment and a heightened sense of euphoria. The events of this first LSD trip became known as Bicycle Day and is still celebrated today as the discovery of the first psychoactive substance with extraordinary potency in low doses. There are few valid and reliable research studies available on LSD's effects on the human mind. It is most generally accepted that LSD works by influencing the activity of serotonin receptors. Serotonin is a monoamine neurotransmitter that is abundant in our central nervous systems and gastrointestinal tracts. Serotonin, which is synthesized in the central nervous system, is responsible for the regulation of sleep, appetite, mood, memory, and learning. The serotonin receptor that is of most interest to scientists investigating the effects of LSD is known as 5-HT2A. Research has attributed LSD's psychedelic effects to its agonistic effects on this specific receptor. While LSD has agonistic effects, it is a combination of inhibited and excited activation at a large number of serotonin receptors that is said to inspire hallucinogenic experiences. Other neurotransmitters may be involved in the production of hallucinations rather than just serotonin alone. However, the complex pattern of activation in primarily this system is said to inspire many of the astounding changes in the human mind during this experience. Hallucinations and other alterations of the senses can make a person see, feel, and hear things that aren't real, or distort their interpretation of what's going on around them. People that have used hallucinogens claim to have seen sounds or heard colors. The most common hallucinations are distorted human faces and cartoon images. When components of the visual system in the brain lack input from other areas of the brain involved in processing the drug, they become hyperactive and excitable, and they start to fire spontaneously, making you see things. This may happen when the brain misidentifies the source of what it is experiencing. A bad trip is experienced when an individual does not respond well to LSD. These can cause extreme paranoia, heart palpitations, anxiety, panic attacks, racing thoughts, aggressive behavior, and severe impulsiveness. The person who is having a bad trip may also experience frightening hallucinations. Some have reported seeing dark images that relate to death or monsters. LSD quickly grew in recreational use due to its known psychedelic properties that inspired its classification as a Schedule I drug in the 1960s. However, containing the use of LSD did not sit well with several researchers because of its potential positive effects. LSD was used in different therapies such as psychiatric therapy before it became a recreational drug. Psychiatrists thought LSD had the potential to cure some forms of mental illness and was given to patients with schizophrenia, obsessive-compulsive disorder, and people with depression, and even those with autism. LSD was also given to alcoholics as a form of treatment due to lack of improvement through other treatments. As an attempt to reform the incorrigible, LSD has even been administered to criminals in the prison system. The drug's ability to allow one to remain aware of their surroundings have also led some researchers to believe that it could help those who are terminally ill. LSD has helped to shape our culture, drug laws, and views on consciousness and the human mind. Public opinion on this drug is opposing, with both sides lacking clear, valid, and rigid scientific evidence. It is advised that safe, ethical, and valid research be designed in order to explore what is truly happening in the human mind when one consumes LSD. Discoveries into this research topic could possibly inspire astonishing discoveries on the interworking of the human mind.